Yeast infection versus genital herpes symptoms, let's talk about it. First things first, let's define what herpes is versus a yeast infection. So genital herpes is a sexually transmitted infection that's caused by the herpes simplex virus. And there's two virus strains that can cause genital herpes, HSV1 and HSV2. A yeast infection is a vaginal infection caused by an overgrowth of candida, which is a type of fungus in the vaginal microbiome. Where yeast infection and herpes symptoms overlap is that they can both cause pain during sex and while you pee, as well as itchiness. And sometimes people can get confused because genital herpes can cause red bumps or blisters on the skin, and sometimes yeast infections will cause a red scaly rash. Some other things that can come with genital herpes that don't come with a yeast infection include wounds or ulcers on the skin, sometimes a fever, or swollen glands. One thing that you'll get with a yeast infection that you won't get with herpes is that thick, white, cottage cheese-like discharge. So when it comes to treatment, yeast infections are usually treated with antifungals and sometimes boric acid, where genital herpes is managed with antivirals. Let us know what other questions you have about yeast infections versus herpes in the comments.